which is not necessarily the right approach, particularly as they may have a more medical than a social focus. It is also important to mention that some of these things also integrate people with experience of care. And the third model within these integrated teams would be examples of social services and employment teams, where a social worker and an employment advisor work together to support the employment and social inclusion of people farthest from the labor market, including both a joint assessment of needs, but also the creation of a joint plan with the person. And the third form of cooperation I'd like to mention is the development of new integrated agencies, which again may have different forms. Let's say the simplest one would be co-locating professionals from other sectors, for example, social workers or social educators in employment offices, so that they can provide a joint plan for people searching for a job who are farthest from the labor market. And integrated health and social care agencies, which have been implemented in some regions in Europe and have a joint or a one portfolio of services coming from both sectors, as well as one management team and one budget. These agencies might sit within or work with local authorities, and they also imply a transfer of responsibilities, both from the local authorities' social services and from the national or regional health service. So all in all, in conclusion, we can see across Europe, and for a number of different reasons, a wide variety of ways in which local authorities are promoting cooperation across their social services and also with other services and in other levels of governments to respond to these social trends, which I mentioned at the beginning, and also the diverse needs of the populations that they support. Thank you.
Great. Thanks so much, Alfonso, for going over some of the different models that have been set up. Just out of curiosity, is there any one that you wanted to flag that you've seen maybe they've tried it in one place and it's scaled up a little bit within their country? Because I think one of the things that everyone's really trying to understand is when you do an experiment, how do you then get it to scale up? So I don't know if any come to mind.
Yes, there are some examples actually, since Giron is here and we've got colleagues from the European Commission. I wanted to mention a couple of them which have received funds from the EU. So, and actually they come from a couple of our members. So two different ones. On the one hand, you've got social history. So the idea is to bring together the data from people who are being supported by social services. There was one example in a region in Spain that was supported by the Social Innovation Fund by the EU to start piloting in a couple of places in the region, but also in a number of municipalities. And after this has been integrated into policy and legislation as part of the wider social services law, and actually has continued to have funding. That's one example. Another example is a couple of professionals coming from social services or social workers in the local authority and employment advisors, the creation of teams joining them up with a methodology to assess the situation of the person and then follow up and evaluation. And this was again implemented also in a European region with innovation funds from the EU, and this has been integrated into their legislation, and actually now they are expanding it across the whole region. So those are two examples, but as you could see, I mean, we wouldn't talk about integration in any of those. We could talk about some form of cooperation, which leads to some form of coordination between professionals and potentially sectors. But, you know, when we talk about actual integration, it's very, very difficult to see anything across Europe. We've got some examples in Northern Ireland, which has been developing this for a number of years now, since the 70s. And we've got the example of Scotland as well. There have been some pilots in England, but the truth is that, you know, large scale integration in this area where we work is very, very limited. And also the question is actually to see whether it is desirable is not 100% clear that it is. There are a number of examples that help, but not necessarily as a whole systems approach.
Great, thanks so much, Alfonso, and also raising some provocative questions about when it makes sense and to try. And I see also in the chat some examples popping up from the social network in Portugal, and I know we have on the call, leaders of organizations like POBAL in Ireland that are really looking at how to support integrated services, and in particular using also EU funds. So that's a great segue to you, Jeroen, who is head of unit responsible for European Social Fund coordination. And I know you've been around the Commission, have circled back now to the social fund. So you, as you heard just a moment ago from that unsolicited testimonial, that the European social funds have actually been very helpful in trying to help link up and develop coordinated approaches that are hopefully achieving better results for people. So maybe you could tell us a little bit more about how, from a European perspective, you're using the social fund to really help encourage these kinds of integration or coordination approaches that can also then be learned and scaled across within countries and even beyond countries.
Thank you. Thank you for inviting me, and happy to be here. And I have to admit, if there would be no examples, I think we would really be doing something seriously wrong. And so let me start by also commenting a little bit on the presentation of Tilde, which I think presents it very nicely and is really very interesting. And I will sort of I hope I can use it also to share it here in house. But one thing I would add is the relationship of trust between managers of different services on local level and beyond. And they go all out and they take a risk by doing things differently from the past. And so you need all these managers aligned in their willingness to take that risk. And that requires their managers also to in a way pass the positive messages and to encourage this. And this alignment of faith, of trust in each other is proving indeed to be complicated from time to time. But that is not what I wanted to say and what my colleagues asked me to say to you. So let me start with that, and let me start to say a little bit about the European Social Fund. And the European Social Fund is really about investing in people in all the dimensions. So public employment services, linked training, pathways into employment, also for those further removed from the labor market, investing in curricula, in the educational system, align it with labor market needs, whether that's private or public sector, both, of course. So we really have also, therefore, a big role to play in investing in affordable, accessible, and high quality care services and the integrated delivery of those dimensions. We finance things for 7-year periods. We have programs for those that don't know the fund so well over those 7 years. And to give you an order of magnitude, the programs 2021, 2027, usually they have a sort of a run over of 3 years until 2030, have a combined value of 136 billion euro. Yeah, so Europe is really putting a lot of funding into this social dimension of our policies, into solidarity directly towards citizens. And we learned a lot also, I think, now in the COVID crisis and the impact of the war in Ukraine, in that I think also politically at the highest level, a realization has come through that social services are really vital. It is more important than previously recognized, I would say, for social cohesion. And I think in the political context of things, this is very important. Is not only that we are relatively starting a new programming period in a context where there's general recognition, more support to do the right thing, but also already now we're starting to look at the future, the next period. And also in that context, it's very important that we build on achievements, but maybe also can be more ambitious. And I hope that will materialize. It will be difficult, obviously. So what are we doing now? Well, we have created relatively recently, we started half a year ago with a social services help desk. I came in this new position for me. I've been working on these matters for a long time, but still about 6 months ago. And one of the first contracts I had to sign was for this help desk. And I think it's a great idea. So it's not only that we get our evidence, that's all very well, but it's especially to help social services and managing authorities to work together, to have knowledge sharing activities, to facilitate access to funding through providing information. Often, our partner social services, NGOs in the field have limited capacity. They don't know where to turn to, and they can turn to this help desk to help them on the way, and also to help them in creating partnerships. And how do you do this? Partnerships with managing authorities and between managing authorities and various social services, in a broad sense, social services. So it's really to reach the local level. And well, so far so good. The first 6 months is of course a build-up period, but we see that this investment is already creating a positive dynamic. So we are quite encouraged by this, and we would encourage you also, if you're interested, to visit the webpage of the help desk, and obviously we can share that. Then in terms of access to services, to give you a further idea on the money side. So that part of ESF financing represents close to 17 billion euro over the next 7 years. Again, that's specifically dedicated to improving access to services and modernizing social protection, healthcare systems, promoting access to social protection with a particular focus on children and disadvantaged groups. And so you see the funding dimension is quite strong. And then the last element I wanted to bring in is one, what we call a social innovation plus initiative. And what do we do there? Well, we partnered up with the ESF managing authority in Lithuania. We signed a 200 million contract about 5 months ago. And they try to take success cases and help to multiply this throughout Europe. So it is not only about financing pilot projects, but preferably pilot projects where there's already a bit of experience, and to boost the use of that, the information, the knowledge gathered in that context, and spread it throughout Europe, to finance projects of that nature throughout Europe, to have this upscaling. I mean, social services, just like any other sector in the economy, needs to innovate as well. Technology offers opportunities. And so this is really, or also different methods. I mean, sometimes we have to look beyond the way we have been doing the last 15, 20 years things. And, there are good ideas everywhere, in Romania, in Sweden, in Spain, and what have you. So the idea is really to spread the news, cooperate, and have an upscaling of successful cases. Often that works, sometimes it doesn't, you have to accept this, but really very much in the spirit of what you're discussing here today. I think that's a very quick overview. I can speak for 2 hours if you want, but it's not the plan. So thank you.
Thank you so much, Jeroen. And also, I think, a couple key words I want to flag that you mentioned. One is this trust element, which I know I've seen in some of the comments and chats that the trust comes at different phases. And there's some question of, do you trust more when you're on the ground working versus when you're in a management higher up position, thinking about who's getting the next proposal and who's competing for funding. So some of the, I think, incentives and frameworks that help us in promoting trust could be thought about. And then you also mentioned technology, which I think is a very important point, that as we do have different opportunities through technology to help perhaps with some of these maybe more coordinated or integrated services, yet we also have other barriers with respect to knowledge and data sharing across administration. So what are opportunities that technology can bring to help us overcome that. So maybe we'll get to some more questions then as well, as we move on into the panel discussion. I'm going to call now maybe to the virtual floor here, Thomas Britton with Greater Manchester, because you oversee a Working Well program that has a history of really helping on employment services and health services. And I was wondering if you could, just sort of kick off by telling us a little bit about how the Greater Manchester Combined Authority, took this idea on board. Kind of what did you do, and how is it working? And I know that a lot of the folks online, and I see in one of the questions, are also wondering if there's any evaluations done of the program that you wanted to share that can also help us in sort of getting that evidence base for why this is worthwhile to overcome some of the barriers and hurdles that Tilda explained earlier.
I think I might be competing for Jeroen's 2 hours here, because there's a lot to fill. But we'll hammer it into a smaller slot than that. First of all, thank you so much for the invite to come and talk in this space. Just the minds, I imagine, around the table and further into the room. The experiences that we've all got extremely valuable in this space, and the opportunity is massive. So I work for Greater Manchester Combined Authority, Greater Manchester in the United Kingdom, England. And I manage a suite of programs / on Alfonso's point, a system of integrated provision and otherwise, called Working Well. When you break down Working Well, that's working, employment, well, health. That's the real focus, work and health. There was a report in the UK by a lady called Dame Carol Black, and we helped it was called Improving Lives, and we've helped her to develop that paper, but also continued with that paper as centre to our programme development, and that is that good work is good for your health, and that vice versa, poor work is not good for your health, and being out of work is terrible for your health, and so on. So Working Well, it's our whole population approach to health, skills and employment, and it recognises that sort of triangulation and interlink between them all. The programme started in 2014, and really it was set out within a devolution context that said Greater Manchester was unhappy with programmes being developed in London, dragged and dropped in Greater Manchester with little or no consideration of the local needs of local people, or indeed the infrastructural systems that already existed in Greater Manchester. And what we said to government is, give us the money and we'll do better. Brave move for something we didn't really know about, we wanted to learn about and otherwise. But we've spent the last 9 years now building a programme from a small pilot that tested sort of key principles that still reside within our programmes now. So to date, we've supported over 68,000 people. 25,000 of them have moved into sustainable work, so longer term work. And when we look at sort of direct delivery, so we've continued a key worker model, providing support to people through directly commissioned providers through direct delivery. But then we've also, additional to that, utilised the system that we've got through our local authorities, through connections with the voluntary sector and through other devolved powers to support clients. Just as an example, one program's got 23,000 people on it, and we've offered 107,000 interventions outside of the programme, across the health system, across the skills system, the housing system, and so on. It's actually 5 on average. So don't do the maths, don't rework that, but it's 5 on average. Above and beyond interventions outside of our directly commissioned employment support. So that gives you an idea of the depth of support that's happening and the range of support and otherwise. So our programs kind of span quite a broad sort of horizon, or a broad spectrum, let's say, of individuals' needs, and with people on the program, on our programs, or specific programs for economically inactive Greater Manchester residents, long-term unemployed, at risk of falling out of work. So those who are in work with health conditions, who might not get occupational health support and are at risk of falling out. And those that are in work as well, in terms of, as in, they own a small business, helping their businesses to succeed and otherwise, and working with all sorts of different providers and otherwise to link the system together. So I mentioned earlier the key principles of the programs that we run, and that's about personalized support. How do we make sure through key worker provision that people get access to the right support at the right point in time? And it's absolutely fundamental to what we do. So, you know, as I say, key worker model, critical to that. That is an individual that sits down, does action plans with our residents that are out of work, unpicks the key challenges and barriers, and then reroutes them into the right support at the right point in time. So if somebody presents with a drug and alcohol issue, who's moving into work, we like to unpick why have they got that issue, what sits underneath it, mental health problems or otherwise, bereavements. 26% of our cohort have been left bereft and have mental health conditions as a result of it. So how do we unpick the right spot, right point of time? Because there's no point getting somebody in work if they've got a drug and alcohol problem straight off the bat, because they're going to fall out of work straight away. Let's unpick the sort of reasons as to why they're there, and also their circumstances. Quite likely, if you've got a drug and alcohol problem, you've been out of work for a long period of time, your housing situation is poor, your skills levels may have disappeared over time, you're at risk, your family might be at risk, your debt, your finance, and it spirals and goes on. So on average, you know, there are, I think, 6 severe barriers to work for the individuals on our program, and that is, I couldn't get a job tomorrow because. So that's that sort of definition of severe. Now, there's only one way of getting the right support at the right point in time, and that is through local integration. How do we do that in Greater Manchester? So Greater Manchester is made up of 10 local authorities, sort of 10 district areas across a city conurbation, and we coordinate that with the local authorities, setting out clear local integration plans, clear asks of providers that are coming in, and otherwise about working together and how we support that co-location, co-production, and so on. And then we have regular integration meetings to stay on top of that. But also, you know, I don't know how I'm doing for time. You know, I think absolutely key to it is about that sort of system that I spoke about, where the fundamental principles of how you orchestrate, just not just support around people, but the broader, how do you orchestrate a system of health, work and skills, and doing that through strategic alignment, setting clear goals and you know, strategic goals around what we are here to achieve, about how we co-produce our projects and programs together, about how we share accountability in delivering them. So it's, you know, it's coming from a high to say this is our key goals and strategy and vision, but it's your responsibility to deliver this part of it and component parts. And it helps us to overcome some of the cultural barriers that have been met. And then shared governance as part of that accountability as well. Underpinning, so final words, because I know I've taken a fair bit of time, but final words on it really is, in 10 years of working across this space for me, there's sort of one's been mentioned already, and that is trust. Trust is so important, whether it's between organizations or whether it be between a key worker and the individual who's seeking support. Trust is essential. But the underpin, the one thing that the integration boils down to, no matter which way you look at it, is about relationships. And relationships are interpersonal. They're between people, and they're very difficult to measure. They're very difficult to manage. People come and go, people change and otherwise, and relationships get established and get lost. And that for me is one of the key challenges as well around integration.
Thank you so much, Thomas. And I think maybe in the panel discussion, if we can get into a little bit more on some of these issues of relationships, trust, and incentives, because some of these incentives frame a bit the actions for those relationships, especially on the ground. And great, maybe in the panel, if you can also share a little bit with us, when Manchester did this, did they pool pots of money? Did they allocate new funds, things like that? So keep that in mind for the panel, because I think everyone would really love to know, especially having been doing this for a few years, the different lessons that you've learned on that front. So we're now going to do a little fly over to Lyon, and we have Aurélie Robin, who is joining us from the city of Lyon. And let's see, there we go, Aurélie. And, you know, you're the head of the France Travail project in the Lyon metropolitan region. And so if you really could help us understand a little bit, what is it that you're working on? Because I know this is also, there's also some reforms in the air, if you will, within France in general. And I know you've been doing some piloting, especially with those furthest from the labor market. So help us understand a little bit about kind of the activities that you're taking and what you're learning in Lyon.
Yeah, thank you for inviting me. Good afternoon, everyone. The French Travail project intends to reform the employment service on every scale. Of course, it concerns the employment policies, but also the social and integration policies. As part of unemployed people are vulnerable and far from finding work. This project was launched last September by the French government with conciliation meetings with all the stakeholders during several months. They dealt with issues linked to employment policy, training, inclusion, integration, and globally all things that could prevent job seekers to find work. So now a draft bill will be proposed to the French Parliament in July with two objectives: the creation of a community and governance for the employment and linked policies called France Travail. And secondly, the transformation of the main French employment agency, it is Pôle emploi, into an operator also named France Travail. It will act as the executive coordinator of these public policies for job seekers. The governance to come is composed by steering committees, also named France Travail committees, on each administrative scales, local, like metropole, regional and national levels. The principal issue is to better coordinate public policies. To this end, all the stakeholders have to work together in a better way, and so all the committees are chaired by both state and local authorities representatives. In order to share the same information on all levels, a unique and shared dashboard will be created. All competent authorities and institutions will be required to share the necessary data to provide the unique dashboard. The draft bill also proposes that the French Travail operator has a leading role into the ecosystems animation, the support for companies' recruitments, and the tracking of all the job seekers, whatever status they have. So the implementation conditions of the draft bill are yet not be specified. So a huge part of the forthcoming reform concerns the French minimum allowance called Revenu de Solidarité Active, or RSA, received by the unemployed people with no income, mostly the furthest from job or unable to work. The French government has launched an experiment on several territories to prepare a reform of the RSA law. 17 departments and Lyon Métropole have been chosen to experiment new services for the beneficiaries of the RSA. The government promotes job for everyone, even for deprived people, aside from social issues for these people. The most debated point of the experiment is the mandatory amount of time dedicated to inclusion actions. This can include medical appointments, language training, activities in community center, etc. Here in Metropole, the president of Lyon Metropole is not on the same line as the national guidance. He wants to promote the right to integration, professional or social, if needed, and absolutely no mandatory activities. Besides, on the metropolitan territory, there is a Maison de l'Emploi, the MME, already in charge of the local coordination of integration, professionals, and of supporting the companies willing to invest in inclusion. The execution of the project involves working on the link between different public policies for the most vulnerable. For example, as a person starts to receive the RSA, she is invited to come and see professionals of different institutions in the same place. It helps her to know her rights and to have access to medical care or to obtain a public transportation card only in the same place. The principal issue is to gather institutions physically in the same place in a third place logic, or more practical with a common service offering. Another specificity of our project is the choice of a wide governance. Lyon Métropole will associate social housing landlords, association working with deprived people, civic participation, as well as integration stakeholders and companies. So this work is new because we have worked on the experiment for only 6 months, but the main lessons are linked to the main lessons I've learned from this work are linked to cooperation and the difficulties you have to conceive common processes and projects. The experiment is managed both by Pôle emploi, the employment agency, a future operator of France Travail, and Lyon Métropole. Change practicing, way of supporting job seekers. It is a long-term work, even if the professionals agree the objective. Besides, building a common strategy involves a change in the strategic position of each stakeholder. It is a very long-term work too. Thank you.
Merci Aurélie. Thank you so much for helping give us a preview also of a reform that's coming down the pike, but also some of the things that you're finding as you help in the piloting of these reforms. And I really pick up this, that everyone needs to change a little bit their strategy in order for this to work, which I think is really interesting. And it ties up also with a question we have in the question and answer function that's in Polish, but translates into a question about whether you need to be fully integrated, or if in some cases just good collaboration with clear objectives and division of roles, if that sort of does the job. So I think it'll be interesting also to pick that up in the panel discussion. So we're going to go to our last presentation, and we're going to fly now over to Brussels. I guess we can take the train from Lyon to Brussels.
Yes, we can.
Yes, for ecological reasons as well. Una Rogier and Alice Baltus. Both
Hello, everyone.
Yeah, welcome, Una and Alice. So you're respectively head and deputy head of local coordination of Actiris in Brussels, Belgium, and really looking forward to hearing about some of the work that you're doing with respect to bringing together locally through the Maison de l'Emploi integrated services for people through the Brussels capital region. So I'll hand over the floor to you, Una and Alice.
Thank you. Hello, everyone. Thank you for inviting us today. So as just introduced, we work for the Regional Employment Office of Brussels in Belgium called Actiris. It is the most important provider of employment solution to both job seekers and employers in the capital. To give you a better insight on the specificity of the Brussels job market, the unemployment rate is 15% on average over 2022. So in order to tackle these challenges, Actiris is working with a network of partners, and each partner has its own objective and targeted beneficiaries. In the past few years, there has been a strong trend toward more and more decentralization of services closest to the job seekers themselves. And our service is called the Local Coordination Service, and it was created in 2012 as a way to bring together this variety of partners in the job market and to create synergies of action and a more inclusive job market. Our mission is to act as a bridge between partners acting at the local level and the regional office, so that the Brussels job market can be a bit easier to navigate for the job seekers themselves. To do so in practice, we created the concept of Maison de l'Emploi, So Maison de l'Emploi are de facto association, so they don't have any legal structure, and it is a local one-stop shop integrating a variety of first-line services for job seekers. So they are distributed by municipality across the Brussels region, and there are 17 of them. They differ in terms of partner composition, size, according to the local context and history of collaborations. Some of them are physical grouping of local partners, so in the same building, and other one are purely virtual one, and other are also hybrid model. So we talked a bit earlier about building trust. To do so, there are different local coordinators from activists that are assigned by municipality to facilitate the links between the different members, to coordinate regular steering committees between the partners, to coordinate also the building of mutual action plan, and so on. They are considered as the ambassadors of the region, but also of the partners themselves. So they are really this interface between the regional and the local level. They also support the different partners in carrying out joint projects that are financed by activists on a yearly basis. And they are financed and they are constructed on the basis of joint needs assessments. What are the benefits of such approach? For the job seekers themselves, first, it facilitates access to appropriate services and information at the right time, in one place, and closer to where they live. It is really important knowing that mobility can be a challenge in Brussels, and in particular for vulnerable groups. In Brussels, we have 19 municipalities, and they are also very different in socio-economic terms. So by having these different Maisons de l'Emploi locally, it allows us to have this local intelligence on issues that are not well addressed and gaps. So this proximity also gives us a way to respond more quickly to contextual changes. For example, it was the case during the COVID crisis. And it allows us to be more agile than a highly centralized player in the employment sector. It's also an opportunity, we talked about it earlier in the paper, it's also an opportunity to test new methodologies and to innovate at local level before taking projects to the regional level with broader fundings, for instance. For the partners themselves, we create these synergies of action. We support them in doing so, and it facilitates adequate referrals of job seekers between them. And it helps also strengthening the labor market governance overall. Really practically, it can also reduce fixed costs by pulling some of the services of the partners together. For instance, reception, meeting rooms, training rooms, and so on. What are the challenges that we face? We identified 3 of them. First of all, the Brussels institutional complexity. So we need to keep a constant watch on our partners, new one, to navigate this complex system for the benefit of the job seekers themselves. That's what we are doing with our service. Another challenge is related to culture and political alignment. We also touched briefly on this earlier, but it can be challenging to bring together this diversified network of actors with different organizational culture, corporate culture. Some of them are politically related, local authorities, others are private actors. So, and the third challenge as a regional actor is to find this right balance between the harmonization of initiative, so for more coherence, and the celebration of local differences and specificities. So we are really always trying to find this right balance. And if you want more information, do not hesitate to ask questions in the chat. Thank you.
Excellent. Thank you so much, Una and Alice. And I know that you're operating in a complex institutional environment, and we're happy at the OECD to actually be working on a study looking at Brussels, a city of talent, looking at some of the opportunities that you have there. And I think you mentioned a lot of really interesting issues associated with local intelligence and very different situations in different communities that these local maisons de l'emploi are able to then highlight with different socioeconomic groups, different professional backgrounds and things like that. Maybe just to have everyone back on the virtual stage in the last few minutes here, because we have a few questions that I think a lot of you would be very helpful in answering. And so, I mean, there's this sort of question about integration versus coordination. So we've had a couple of questions on that front. I don't know if anyone wants to pop in on their thoughts on that. And I don't know if Thomas, you know, if you would consider yours more integrated than some of the other models you heard about, or if it's more coordination, and for others to sort of jump in on this, you know, integration versus coordination question, which I think a lot of people are interested in hearing about.
Karen, I wouldn't dare make that statement. You know, not with a short 10-minute overview of everybody's areas, but I'm confident that we've got a well-integrated system here in GM. I would say coordination is part of integration. It's, you know, you can't have integration without coordination. It's a big part of the relationship development. It's a big part of the strategy development, big part of the co-production and whatever. So it's fundamental. But I suppose what we might be saying is, do you need to have all this structure in place to deliver good relationships on the ground? And I think that's where that question might be coming from. And I would say it depends on the size and scale of what you're trying to deliver. I think delivering integration or a coordinated approach to providing support on a project where, you know, it's a more of a controllable environment, then the answer to that is no. As soon as you start going into that larger space, and Alfonso's point about system integration, then you start to need structure and framework and agreements and service level agreements to kind of policy, practice and otherwise. So I would say you're all right with coordination for a little while, but you can't coordinate data sharing in that way. You need structures. There's the legal sides of it when you're looking at pooling budgets and otherwise. And Karen, I know you mentioned pooling budgets, such an important part of, you know, for us, the next phase of devolution and further integration is about how we chuck all our monies into one pot and make the right decisions, and sparing perhaps outside noise from central government or other actors. So I think it's again a really important point that structure depends on size.
Right, and then I know we have some time constraints, but if Jeroen or Alfonso had any comments they wanted to come in on in general, given the discussion before they have to leave, if you had any other sort of final reflections or thoughts based on what you've been hearing today.
Very briefly, I would say, well, I agree with Thomas' comment. You cannot have integration without having coordination in the first place. I see more cooperation and coordination as more day-to-day, and you could have, for example, professionals working together, cooperating with each other, or also coordinated service delivery and coordinated provision. Even you could also have an integrated approach to service delivery. But if we talk about integration as integrated system, I honestly think that there are very few integrated systems in Europe. Honestly, like really, we've looked a lot. And when you look at integration, you really have to have in place a proper structure. You have to have, I think, in addition to the question of having a joint budget, pool budgets, management teams, you have to actually be ready, be mature enough. So the sectors have to be mature enough to be able to speak to each other at the same level. And this is not that easy, because usually what happens in the sector in which we work is that social services are in many cases actually underfunded. They are not necessarily at the same level that employment might be, that health is. So they're usually the poorer cousin of, as they say in the UK, of the NHS, for instance. And indeed, we see that, and that complicates the question of integrating. Again, whether is integration the right answer is also another question as well to look at. So I think that these are my general considerations and my general feedback there. But I do think that there are very good examples of coordinated approaches to service provision across a number of countries, also about coordinated ways in which services are being contracted out, in which public authorities are working with service providers, as I said, not necessarily seeing them as contractors, but more seeing them as partners, changing also some of the ways in which public procurement coming from the EU is not necessarily the best way in which services, particularly social services, can be provided locally. So I think we need to look at the wider picture and not just focusing on the term integration and integration as the panacea, but more looking at the final objective and seeing what's best to make sure that the objectives can be delivered. And it will change from place to place, and it will change also from organization to organization. And of course, you need to look at the type of persons that those services are trying to support as well. What are their needs? What are their requirements, and adapt your services accordingly.
Thank you so much, Alfonso. And then I know, Jeroen, you need to leave in a couple seconds here. So
no, I first of all on integration and versus coordination, I think Thomas put it very nicely, and I can really not improve on that. But what we try to do on the European level is one to put in place the structures. So that people can find information, can find good practices, can get there the experience. Also, as Thomas explained a bit, to move, it's all very well to have a good cooperation on a local level, but how do you create this on a bigger scale? And what are the service agreements that lie behind that in order to make it a bigger success, a wider success? And so I think we try to put in place the examples, the contact details. I think, what I see is that people are very outgoing in sharing this information. We're doing a lot of outreach activities, a lot of communities of practice activities to promote this actively throughout the managing authorities. They have a specific priority in all their programs, each member state, on social innovation, in which these kind of things can be pushed forward. So I think there's a sort of a framework there. It's not perfect, but it certainly provides a lot of tools and elements to build on. And then I would say, last but not least, that then luck favors the bold. There needs to be a sense of initiative, like an entrepreneurial initiative for individuals, a group of individuals, to move forward on that in their town, in their community, and be brave. And this is difficult, but you see it happening throughout Europe with extremely positive results. I was last week in Sweden, where we visited 2 projects of this nature. One with people further removed from the labor market with mental problems, and they can be brought back in, and that it is possible, and even with very positive results, both for the individuals but also for the businesses that hire them, or for the public services. And so I think there's a lot of good out there and possibility for progress, and I'm rather optimistic, I have to say.
Excellent. Thank you so much. And I know you might have to log out before we wrap up. Thank you again for taking the time to be with us here today. Aurélie, Yuna, Alice, you've heard a little bit of some of these different discussions. So from the Brussels capital region and the experiences with the Maison de l'Emploi, what is sort of the next? Is there any sort of next thinking, or where do you see you need to take this after, having set up this infrastructure of these entities that are trying to bring this local coordination? What do you see as sort of the next goals that you have?
Now it's to have a better ecosystem, a larger, more larger. So not only the first stakeholders, but to see now further for other stakeholders to work with us and to make more co-construction and so on.
Okay, great. So bringing more people under the umbrella of the Maison de l'Emploi, and that everyone sort of is aware of what are the resources and how to make it work. And Aurélie, you're in the midst of testing for a reform that's going to go nationwide. So I know that you've had some of these experiences in testing. Are there any other sort of lessons you want to share on this effort to bring together sort of national offices of the employment service with the Lyon city, and where it will be like, you know, around, of course, other parts of France? Anything else you want to add on this experiment that you've helped with in Lyon? Oh, I'm not sure, is it just me that's having trouble hearing?
I can't hear either.
Ok. Aurélie, on vous entend pas en fait. Je ne sais pas s'il y a un souci de micro.
Is that c'est mieux?
Ah, that works. There we go. That works. Okay, great.
Thank you. Sorry. The next now, yes, we are experimenting. It's very new, but the most important thing, I think, to create cooperation, it's to create a common culture with the professionals on a level and with the institutions in another level. For the professional, we are working on a schedule of shared culture for professionals. Our objective is to gather the professionals who coach job seekers from social service associations and job centers together one day each month. They will have e-learning classes on new tools, exchanges, on practical situation and information about service offerings. It's important to create culture, trust, to cooperate.
Great. Well, I think that's one of the clear common themes that we've heard: trust amongst the different public authorities, maybe the social economy or nonprofits that are also supporting, but also trust between the officials that are helping and the people that they're serving. So I think we've come actually to the end of our hour and 15. I wish we could go much longer, but I know people have really busy schedules. So I think this is a conversation to be continued, because I know there were lots of other interesting questions as well in the chat on different ways of financing this sort of integration coordination. What are the sort of sparks for this entrepreneurial spirit locally to make it happen? How to better use different existing systems. I saw there was a little debate there on the chat about also procurement and some of the other ways that we try to make integration happen. So again, I think we'll have to continue this conversation with some other webinars and activities through our local development forum, and then through your other different venues. So a huge thanks to all of our speakers for coming from, you know, the European perspective all the way down to the sort of city perspective. So really appreciate all of your time today. And look forward to future webinars. So just so everyone knows, if you're interested in learning about how you can get the most out of global events for local development, like if you're hosting an Olympics, for example, or something, don't hesitate to join us on July 6th. And then I think in the month of September, where we have a number of webinars coming up also on the social economy, which tends to be also a very important actor in helping to provide tailored integrated services, both directly and as a supplier for some of the entities that many of you work for. So again, thank you so much, and have a wonderful afternoon to all of our panelists and our participants in the webinar.
Thank you.
Thank you.
Thank you. Goodbye.